Gerald. Today I want to talk about the shoulder. So be on the lookout as we take a drive into shoulder pain and understand exactly how it arises, what causes it, and what we should do should this condition occur. Thank you for tuning in once again to our session on Healthline. I want to continue our discussion from the last topic when I dropped the hint on shoulder pain. The shoulder pain discussion has become very important because it is a very common presentation in the clinics, and that is why I brought it to you, to your doorstep today. What is the shoulder joint? Today we're going to take a little dive deeper into understanding all as much as possible around the shoulder joint. The shoulder joint is that joint formed by the glenoid cavity and the head of the humerus. As I have here, I have a bone showing this is the scapular bone, and right here is the glenoid cavity. And then here is the humerus, and that is the head of the humerus. And when they come together, they form the shoulder joint. And very importantly, here you have projecting from the back of the scapula is the acromion. These together form the shoulder joint that has got a very high range of mobility. What do we use the shoulder joint for? The shoulder joint is used for driving, to move your limbs, to scratch your back, to pick up things, and to lift up objects. What is the problem that is commonly seen around the shoulder joint? First of all, I would like to drop a very important hint as I discuss further. If you have pain in the shoulder joint and you also have difficulty with breathing, I want to say you have to see your doctor, because that may be an indication of a heart attack. That can be very dangerous. And so if you have a combination of pain and difficulty with breathing, then you must see your doctor. Now, what are the symptoms that you have in patients who've got problems with shoulder joint pain and challenges? One, there can be swelling. There can be swelling around the shoulder joint. And there can also be redness as a sign of inflammation that is taking place around the shoulder joint. It could feel warm to touch, and it can also be tender. When you have any of these symptoms, this is the reason why you have to see your doctor, so that your doctor can take time to examine you and tell you exactly what you have. What would the doctor do for you when you see the doctor? The doctor is going to have to take a history, and the history is going to be asking you questions around the shoulder joint. Questions like use of your arms, how you use and how you sleep and how you perform your daily activities can be indicators of what went wrong and how you developed the shoulder joint pain. Shoulder joint pain can arise from disuse of the limb, abuse of your hands when you're using them to perform extreme or overuse. This can result in pain on any part of the shoulder. Now, talking about examination, the doctor is going to take time to examine your shoulder, looking at the range of motion, checking the muscles, and also palpating to be sure that the area of pain is within or extends beyond the shoulder joint. There are important investigations that can be done. These investigations will help the doctor to confirm the diagnosis. The number one investigation that is very important is the X-ray. The X-ray is going to help to show the bone as I have described in the model that I used. It would describe exactly what is going on within the bone of the particular individual. Other better ways of defining the shoulder joint could be the CT scan. Sometimes you can also have the MRI, the magnetic resonance imaging. This would help to show some of the soft tissues and depict them even more clearly. Ultrasound is also one of those tools that can be used to diagnose patients who have got shoulder pain problems. Now, very importantly is arthroscopy. Arthroscopy is a minimal invasive surgery where a little incision is made and then a camera, small, is placed right into the shoulder, and then we look at all the features, looking at all the structures within the shoulder. It can be both diagnostic and therapeutic. In my experience with arthroscopy, it has been very helpful. Why? Because it's done as a day case where the individual has the procedure done on that day, and the individual can also go home on the same day. So, what is it that happens in the shoulder, and what is it that goes wrong in the shoulder? There are several of them. I'm going to try to, within the few minutes I have, to talk about the important ones, and then subsequently we can, through your questions, attend to the ones that are particular to your case. I want to start by talking about bursitis. The shoulder bursitis can occur in an individual. Now, what is a bursa? A bursa is a small fluid-filled sac that is usually found within the joints surrounding the tendons, giving the tendons the cushioning effect and rubbery effect to reduce friction for them to perform their function effectively. Tendinitis is another thing that can happen in the shoulder joint. In the shoulder joint, as we talked about during the anatomy, it will be good for you to understand that stabilizing those bony structures you saw are very important soft tissues like the ligaments, the muscles. And of prime importance in the shoulder is what we call the seats. They are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. These four muscles or tendons put together are called the rotator cuff. Now, any of these tendons can be involved in an injury from prolonged use, like I used the word overuse, and result in inflammation of that tendon, giving rise to tendinitis. This tendinitis, when it occurs within a short period of time, can be said to be an acute form, seen commonly in swimmers and those who play tennis because they have overuse of their particular shoulder. It can also be chronic in those cases where over a long time, especially in the elderly group, where these tendons, due to wear and tear, have undergone some inflammatory changes. You can also have another condition which is referred to as a tendon tear. There can be a tear in the tendon. This usually will follow sports injuries and also can also follow overuse. Another thing seen commonly in the shoulder is called the impingement. Sometimes we call them the impingement syndrome. The impingement syndrome occurs because the tendons that are within the shoulder are right sandwiched in between bones. So as we described, you have that these tendons have to slide in between these bones, and when they have been used over a long time, probably in the case of overuse, they can result in inflammation. And when they get inflamed over a long time, they can impinge and prevent the joint from moving freely. This can result in what we call the impingement.